Hi, my name is Adriel William, and today's video is for all the foreign trained dentists who are applying to CAPET and dentist school in the United States and want to improve their profile and increase their chances to get accepted to a dentist school in the US. And most of the people ask me this question whether I should do a master's, how I can improve my application, and which kind of master should I be doing. So I'm going to be discussing that. And before I do that, I would tell you the least expensive way to improve your application and improve the chances of getting accepted is through improving your Toefl score. So if you can work on your Toefl, improve your overall score in Toefl, go above 110, 115. If you can score that, it should exponentially increase your chances of getting accepted. And in the past, I've been telling in a lot of my videos how Toefl is a bottleneck area. Most candidates, most dentists get stuck with it because it's not an English exam, it's a strategy exam. In future, if I have a chance and if I could, I would officially write an email to all of the schools and tell them that TOEFL is not even a good evaluation of English that the foreign trained dentists like us have to take, and this exam should be eradicated. I personally feel it's not a very good exam to judge somebody's English, but it is what it is. And I wanted to share that there are three platforms, three YouTube channels that personally, when I was giving my TOEFL exam and I scored 113 uh, back in 2019, three YouTube channels that helped me was number one that I mentioned earlier too is Notefull. So Notefull is a channel which was really helpful with all of its videos and content. The second was a called TST Prep. It used to be pretty good as well. I really like the content. The third one is Lingual Marina. I am not a big fan of it, but it pops up a lot on YouTube algorithm. I've seen a couple of videos. You can check the content for yourself. Sometimes it's fun to watch educational video of somebody who's aesthetically pleasing. So, but overall, you can just see that channel and judge for yourself, and that helps you too because some people do recommend it. So, the first two are my personal favorite when I was applying, and you can look at the third one as well. I will write these uh, YouTube channel in my description so you can watch it. Now, coming to the masters discussion. So, a lot of people recently said, I have a master's in informatics, bioinformatics, I have a master's in technology, I have master's in biochemical waste, I have master's in health administration. Uh, would the schools like this or not? Which kind of masters I should be doing? So my number one suggestion to all the people who are thinking about masters, especially people who have done BDS years ago, like 10, 15 years ago, and they have been very much distant from educational platforms. For example, I had candidates who did BDS back in 1999, moved to US after 10 years of experience and been working as a dental assistant, and now they have a low GPA and they haven't went to a school since a while. And what happens, the schools are trying to figure out that this person did a lot of clinical work, which is very good, but they have not been in touch with the educational realm. They haven't been in the academic realm. They haven't been a student for a while. If we give this person admission, will this person be a good student? Can they survive in the environment with the technology, taking orders, doing assignment, and studying, and all of this? Because to be honest, the older I get personally, it becomes more difficult to be a student all over again because your mind is more about practicality rather than didactic work. So, a lot of candidates who have this kind of background where they did BDS couple of years ago and didn't had a great GPA, maybe doing a master's would be a good option. And after that, I feel people like me, when I moved from US, I for 4 years I didn't do any dental assisting or clinical work in the US. But during my interviews, during my application, I personally believe my master's in health administration was compensating for my clinical work as well, a little bit. If If you ask me personally, I feel dental assisting is a very important part. At least 1 year of dental assisting in US shows that you're somebody who can survive and work in the dental setup. But on top of that, if you can do a master's, that really gives you a kick if you have a good GPA in that. So if you're somebody who didn't had a very good GPA back in your BDS and now wants to improve it, doing a master's is a good process. Now, the next question comes is that if I'm going to do a master's, should I do an MHA, MPH, MBA, or what kind of master's would be the best useful? To be honest, if you can find a master's in the field of dentistry directly, like something in orofacial pain, I know USC, University of Tough, has residency in that. If you can do something like that, it's better because it's clinical. So if you can find a clinical master's, of course, that's the number one priority that you should have. If you can't do that, something in health administration, MPH is given preference. Why? Because it's related to health system. These days, a lot of people do bioinformatics because IT is a very good field as well. You can assimilate with that. But now, I personally had a candidate who had a master's in biochemical waste, and somebody had a master's in technology. And they said, we personally feel schools will reject us because we have a master's in technology. And I tell people the schools won't reject you. Even if you have an MBA, even if you have a master's in technology, that doesn't mean that you're a bad candidate. You're actually a good candidate because during your interview, the school will ask you, how did this master's make you a better student, or will make you a better student for dentistry? And I tell people is that during your interviews or during your emails, tell them that through this master's, I got to learn the importance of technology. I got to use Canvas. I got to use software like Blackboard. I got to work with my faculty and my peers in group setting in a professional manner. And along with that, I got to learn the importance of insurance, organizational behavior. I got to learn about I also got to learn about insurance system, patient confidentiality, and you can mention it also taught you the culture of how academic institutions work in the US. So what you're trying to sell or tell them that this master's program, regardless of what it is, has somewhat hammered me and trimmed me down or trained me to be a student. And the schools personally like these foreign trained dentists who have done some kind of schooling because after they see you have done 2 years of masters or you have done some kind of educational preceptorship, they believe that this person can survive in an academic setup. So they give you preference. The second thing I'll say, I'll sometimes candidate email me or message me that can I do an online one? My suggestion is look for a school, and they also ask which school is good. My suggestion is look for a school that has an attached dental school. Like if you get to do a master's from University of Alabama, or you get to do a master's from University of Howard, anywhere you have a dental school attached, it's better off because during your masters, if you can go and visit the dental school, make contacts, do some kind of shadowing, do something like a research that will give you some edge. So it would be like a gateway to get into the dental aspect. The second thing is if you can't do that, like I did my master's in health administration from a university called Mount St. Mary's in Maryland, and it didn't had a dental school. So what you can do is some people say, can I do an online one? My suggestion is if you can find something which is not super expensive and where you can do in-person learning, that's better. If not in person, find something hybrid. If not hybrid, you can go for online. It's not a bad thing, but personally, if you're paying for a master's, it's better you get to learn by being there in person. But I know a lot of people have families, a lot of candidates are mothers, and financial aspect and traveling. You can pick and choose whatever works for you. Along with this, I would say once you do the masters, it's very important. that you use that masters to build your communication skill. You learn how to make contacts, and you use it when you reach out to schools, when you reach out to dentist schools. Tell them that you have done this masters and it have taught you this, and how it will make you a better student. That's a very important thing. Now, I hope this video helps you, and I would really appreciate if you like the video. And if you have any questions similar to this, or if you're currently doing a master's, or you're applying to a dentist school, or you're planning to do a master's, you can, if you have any questions, write in the comment box. I would like to know what is your questions when you are thinking about this master's process, or you're thinking about improving your uh, capit profile. And I would like to know if you want me to make a video on a specific topic. You can mention that in the comment box as well. But I would be highly encouraged if you hit the like button, subscribe to the channel, because 60% of people, you might be one of them, who watch my video don't subscribe. And if you want me to make more content like this and support foreign trained dentists, kindly help me out in this process. And hopefully, I'll see you in a more meaningful video. Thank you.